Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one on one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know I always like to go over my disclaimer and reminder that there are no absolutes in medicine. You know, we treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of my videos that I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, a 73-year-old male with severe COPD stage 3 presents to the clinic with increased shortness of breath, a productive cough, and more frequent wheezing over the past week. He has a history of 2 exacerbations in the past year and is currently taking a SABA PRN and a LABA. His FEV1 is 42%. What is the most appropriate management for the patient's acute exacerbation? Is it A, a LAMA, B, a SABA, C, long-term oxygen, or D, an inhaled corticosteroid? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure that you're answering what is even being asked of you. So here, the stem of the question states, what is the most appropriate management for this patient's acute exacerbation? So simply put, they're asking you for treatment. So I always tell y'all, if they're asking you about the treatment, I want you to run it back and see if they have provided you with the diagnosis. If they have not provided you with the diagnosis, you need to run it back a step further and look at the assessment findings so that you're able to determine what the diagnosis is. But here, the diagnosis is provided. It states that the patient has severe COPD stage 3. And this patient continues to be symptomatic, having exacerbations despite being on the SABA PRN and a LABA. But when we remember in stage 3, we want to make sure to put them on what? And that is D, right? Remember Brittany's brilliance. I tell you, think of the 3 letters ICS and stage 3. So you want to put that inhaled corticosteroid in stage 3. All right, question number 2. A 65-year-old male with stage 3 COPD presents with worsening dyspnea, increased coughing, and 2 recent exacerbations. He has a history of heart disease and hypertension. His FEV1 is 45%. He is currently on a SABA PRN and a LABA daily, but his symptoms are not well controlled. What is the most appropriate next step in managing his COPD? Is it A, long-term oxygen therapy, B, a SABA as needed, C, an inhaled corticosteroid, or D, to start a systemic corticosteroid daily? Take a moment and tell me what you got. So the stem of the question here states, what is the most appropriate next step in managing his COPD? So again, it's asking for treatment. So we're looking to see if a diagnosis has been provided, and it has. This patient is also in stage 3 COPD. So even though we're talking about them being on the SABA, the LABA, again, just like in question number 1, that we're going to add an inhaled corticosteroid into that regimen for stage 3, right? So C is your best answer. All right, and lastly, question number 3. A 69-year-old female, a former smoker with a 40-pack year history, has stage 2 COPD. Despite using a SABA PRN, she has had 3 exacerbations in the last year. Her FEV1 is 65%. She reports increasing dyspnea and reduced physical activity. What is the most appropriate next step in her management? Is it A, continue the SABA as needed only? B, initiate a LABA? C, initiate an inhaled corticosteroid? Or D, start long-term oxygen therapy? Take a moment and tell me what you got. All right, so stem of the question here states, what is the most appropriate next step in her management? All right, so again, we're looking for treatment. So you want to run it back and see if a diagnosis has been provided. And it has. She has stage 2 COPD, right? The moderate stage. She's already on a SABA PRN. So in stage 2, what medication do we like to prescribe? They're already on that short acting as needed. Stage two, now we need some more on a daily maintenance regimen treatment. So you want to initiate the long acting, right? So B, initiate a LABA. They're already on the SABA, initiate a LABA. You also can use the muscarinic agents, right? So you could have been on a SAMA and initiate a LAMA, right? So stage two, we want to put our long acting on board and refer them for pulmonary rehab. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number one, at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. Also, if you're someone who prefers to review independently, the self-paced review course for family and adult Gero are also linked in the bio of this channel. If you're looking to do any practice question, all of my QBank options are linked in the bio of this channel. And if you're looking to book any one-on-one sessions with me, I always say either call, text, or email, as I offer a variety of one-on-one session types. So I prefer to speak with you first to gauge what you truly need to make sure that you are booking the appropriate one-on-one session for your needs, okay? All right, you guys, as always, y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.